Hi, it's me, Dr. G. So hydrogen's benefits aren't magic. They're medicine and they're dose dependent. Get too little and you'll probably feel nothing. Get enough and you can maybe slow, stop, or even reverse oxidative damage and challenges driving disease. So there are 3 common ways to load hydrogen into a person's body. Effervescent tablets that drop, fizz, and then you drink. Molecular hydrogen-infused water that'll do like 1 to 2 liters a day from a bottle or a generator. And molecular gas inhalation through a nasal cannula delivering a steady hydrogen flow. Each lane delivers a radically different payload and therefore a different level on the slow, stop, reverse spectrum. Let's break it down. Tablets are slow on the decline and slow period. High-grade tablets can hit 6 to 8 parts per million, maybe 4 to 5 milligrams of hydrogen per glass, and research shows that a much higher parts per million needs to happen for appreciable antioxidant effects. Even if you use them 2-3 times a day to slow oxidative stress, it's probably not an appropriate standalone treatment. Most water generators top out at about 1 to 1.6 parts per million. Even drinking 1.5 liters a day, you might get 2 to 2.5 milligrams of hydrogen, which might help with inflammatory markers in the gut, but probably not too much more than that. Molecular hydrogen inhalation via a clinical unit can support 600 mLs of hydrogen per minute, and in 15 minutes you can breathe in almost 1,000 milligrams of molecular hydrogen, orders of magnitude more than water. And a single session can flip metabolic switches towards 16% more fatty oxidation, indicating greater mitochondrial efficiency. 1 liter of molecular hydrogen gas equals about 50 liters of 2.5 parts per million of water, and most devices don't even hit 1.8 parts per million. So dose comparison becomes impossible. The flood of molecular hydrogen can reverse acute oxidative spikes seen in flares of colitis, neurologic disorders, cancer symptoms, and generalized inflammation, or even intense athletic overload. What level are you aiming for? Steady maintenance, halting progression, or turning the tide? An 8 parts per million tablet in water could only be considered as a supplement to molecular hydrogen inhalation and not much else. Molecular hydrogen water, because of its dose, might help with gut health, but really not much more. Multi-center clinical trials showed that appropriate dose inhalation makes the clinical difference. Molecular hydrogen therapy isn't a one-size-fits-all, it is dose-driven. Using tablets to supplement inhalation and daily wear and tear. Use hydrogen water to address gut issues, but turn on inhalation when you need to address and even reverse a crisis. Pick your lane, match your dose to the goal, and let molecular hydrogen do the heavy lifting.